Hello, everyone. It's Steph Miller here. I'm here tonight with our special guest, international guest, Eunice Bredenkamp from Nimue Skin Technologies. Welcome, Eunice.
Oh, thank you so much. And you said the name correctly, which is quite amazing, coming all the way from South Africa.
Well, you have such a beautiful and exotic name. I wanted to make sure I was pronouncing it well.
Thank you.
Well, thank you so much for joining us. We've actually got a pretty important topic that we're talking about tonight. And it seems to be the topic of the hour, really, with the Aesthetic and Beauty Industry Council actually having a lot of inquiries about the COVID vaccine, a little bit about what skin treatments they can do pre and post the vaccine, what type of skin reactions to expect. And so this is all sort of new. We're not new to the vaccine world, obviously. We understand how that works, but we're new to the COVID-19 vaccine world. And we thought we'd come on this session just to talk a little bit about, skin treatments and how we deal with, post COVID-19 vaccination sort of reactions, if you will. But before we get started, I'd love everybody listening tonight to learn a little bit more about you and about your role, a little bit about Nimue Skin Technologies and also Vital Plus.
Oh, thank you for the lovely introduction. And you're so right. This is the topic of the hour. Vital Plus is an amazing distributor of Nimue in Australia, but not only of Nimue. Frank, Lena, and his team distribute quite a number of brands into the Australian health and skincare market. They are very into healthy skin brands, health brands, looking at the skin barrier, no harm, respecting the organ kind of brand, of distributor, which really links well with Nimue. Now, my passion and love for this brand started 20...
I'm so sorry.
Not a problem.
I just switched on out to see if we were live on Facebook and you heard it. We are.
It's not nice to hear your own voice, I must say.
You have a beautiful voice. Okay, that's counted. That's number one technology fail for the night.
But that's technology that makes it exciting and fun. But yes, I think the passion for the brand I represent as well started 27 years ago when it was launched into the South African market and eventually into the world. It's a brand that focuses on, again, skin health, but focuses on respecting the organ. Sometimes we forget we work on an organ. And that is really, I think, why I'm so passionate about this brand and why I can safely introduce it into the market in this time with all the questions that we have, our clients have, and our distributors have.
Well said. I mean, you can see the passion when you speak about what you do. And, obviously for being in the industry for so long, you have to have that love for what you do. And I think we all share that with you, everybody from the industry. We choose it because it is a passion. We choose it because we have this overwhelming desire to help people and help people with their skin. And of course, we as therapists are very particular about what we do, how we perform it, the repercussions of these, skin treatments. And we really want to get great results for our clients. And so you introduce this unknown element into it now, which is, COVID and the COVID vaccine. I think we started off, I suppose, with seeing in this whole COVID story, we started off seeing a lot of skin reactions to wearing masks. They call it masking, I think they call it. Yeah, lovely name. So we started seeing a lot of that, and we had a lot of discussions about how to treat that. And now that we're all open, especially in Australia, and a lot of people, 80% of people would say in at least New South Wales and Victoria are now vaccinated. Mm-hmm. And we're starting to hear a little bit of reports of saying, look, I had a really deep, intense pigmentation peel, and it was quite an overreaction, and it just so happened to be, 48 hours after a vaccine, and and then we start to hear trickle in reports about dermal fillers, and now even skin needling, and even some other types of peels. So tell us what you think might be happening here.
Yes, you know what? I like to call it a storm of thoughts, because actually all of this, all of these reactions we see, whether we've had COVID and the reaction post-COVID, or whether we've had the vaccine, and the reaction from the vaccine is to do with inflammation. It's this crazy response to this wonderful system in our bodies that protect us. So we need to have inflammation. We need to create an inflammatory pathway so that we can heal. But what actually happens is that so many patients that had COVID, and some had it really quite severe, those that are lucky then to have survived, and some, of course, even to a certain degree after the vaccine, there's an over vigorous immune response to go and protect. That's why we've seen people suffering from all these skin conditions, and even baldness have become quite a factor to consider. Now, when this inflammation pathway, this cascade is stimulated, we know that it's the cytokines create this storm. So it's actually called the cytokine storm.
Yes.
And our immune system rushes to protect us, whether it's a pathogenic infection, an uncontrolled inflammation that then leads. So obviously, when we had the virus, which I did have, so I really speak from experience.
Oh, wow.
Yes. And
I had no idea, Eunice.
It was quite interesting. So I can relate to a lot of these symptoms. And that's because of that cascade, that it looks like a gridlocked traffic jam in your cells of your cytokines, of this inflammation trying to fight. And that is why so many clients with maybe certain diseases, your diabetics, etc., they're pro-inflammatory, associated with the cytokine storm, have been crazy in the body. And they've actually in tests detected that the cytokine influence in these patients that could also then obviously lead to death, organ failure. And in our cases, where we are the lucky ones, in skin and hair reaction.
And that's really important what you've just said as well. And that's why people often wonder, why is it that, you know, people who are overweight have such a severe response? And that's because your, you know, obviously your adipose tissue is a harbinger storage of, you know, a lot of your dendritic cells, and inflammatory cytokines are in there. And, you know, you have a multiple number of pathways there of inflammation. Right. And when obviously when you're infected, or even if you get the vaccine, they all rush to the area to try to start, you know, the B cells and T helper cells, they all get involved. And then that starts to create that storm in your bloodstream. So yes,
it's a big,
very interesting
storm happening. So it's all because of the storm. And also very interesting is the effect the vaccine and the virus has on your mitochondria. So we know that the mitochondria is the powerhouse of your cell. I mean, we need to have healthy mitochondria. We need to have functioning mitochondria. And the mitochondria is responsible for so many things in our bodies, in our skins, in our cells, and for the immunity, together with our immune system, homeostasis, creating balance, and then of course for cell survival or cell death. So COVID and some of the vaccines have also had an influence, basically hijacking the mitochondria function. And that's why we end up with this vulnerability that we see in our bodies and in our skins.
That's really interesting that you bring that topic up. I was going to bring it up a little bit further down the track, but it's wonderful that you brought mitochondria up, because of course we as skin therapists have the ultimate, I suppose, you know, stimulation device for mitochondria, and that's low level laser and even LED treatment. And there's actually some studies out there, and some, you know, anecdotal studies that, you know, people suffering with COVID-19 under LED and under low-level laser therapy actually fare quite well, and the recovery is assisted using that. We have our devices at hand to be able to treat these, you know, mitochondrial load, I suppose, on the mitochondria.
I think we do far more than what the medical or the industry realizes is the power the therapists hold in their hands with what we offer the clients. And we did these things without knowing, because research is busy happening as we speak. This is newish to us, so I think it's incredible.
Well, Harvard Medical School's been at it for a while with low-level laser therapy, and obviously they published a paper that confirmed that inflammation was the common causative factor in all diseases, and certainly we know that it's the common causative factor in all skin related concerns. And with that comes, how do you then restore normal function to that cell? And obviously the impediment there is going to be, that we know is going to be that COVID-19 vaccination. So how do we then utilize that? If we know that the COVID vaccine is going to have a similar effect as COVID, but, obviously in a less and more controlled way, how do we then overcome these skin related concerns caused by your immune system? How do we alleviate those? And you're right, we've got the power at our fingertips, and literally it's called low level laser and LED.
Yes, absolutely. So I just, with a vaccine, the symptoms are different, of course, than with the post the disease. But post disease, you will meet many clients that have had it, that's going to come back for treatments when they're better. And I can really speak from experience. The results post being ill lingers. And sometimes the client actually thinks she does not see side effects, and weeks or even months later, which she then could associate with the vaccine that she had in the meantime, which actually could still have been from having the virus. So we are in a very interesting game of infection and where it is. So it's very important that we look at the distinctions, the clear distinctions, the symptoms we know of COVID, and the symptoms, the clear symptoms of the vaccine. Those typical ones are the sore arm on the site of injection. I remember it felt like I exercised one little muscle only severely. It was too painful to lift my arm. Feeling exhausted a few days, 2 to 5 days after the vaccine. That headache, the feeling achy, feeling ill, that is what we typically associate with post-vaccine.
Yes.
But there's more to that, obviously, and it has come to the fore. It's been seen now that post-vaccine cases have been reported where within 24 hours up to a week and 12 days even, not only in the localized area of the vaccine, but that the mucocutaneous reaction is becoming evident. Things like pruritus, urticaria, angioedema, that severe edema in not only the site of infection, and that is because of the RNA messenger system that reacts differently in different people. And interesting, I don't know if you knew this, but it's found that men were less likely to have a skin reaction post-vaccine than women.
Yes, I read that. There's a study that came out. Actually, they minimize it. So it's so great that you've actually said that, because reading the studies, you can see the minimization or the the lack of connection between delayed post-reaction, post-COVID vaccine reaction, and, things like urticaria and, pruritus, they actually are linked, but they are so linked down the track. So maybe 10 days later, 12 days later, that doctors are not then linking them and saying, look, this could actually be something to do with the vaccine. So I'm so glad you brought that up, because I did have a little squiz at some of the studies that came out, and they said that they're very rare instances where, you're affected cutaneously from the vaccine. And I found that very interesting, because we work in skin, so we see it, but what's actually been reported has been a little bit different.
Yeah, absolutely. And there are clients that won't have one of the symptoms. Their skin will not react in any way. So that's what makes this a challenge to work with. We must treat every client as an individual. And we have to actually even look at not only the post-vaccine, the post-COVID, but even indirect causes of reactions that we see now with the masks, the mask that you mentioned. In some of the treatments we do with laser, that we wear goggles. So the goggles, the mask use could cause certain dermatitis, could cause bruising. It could actually even cause cirrhosis. And then we have also seen conjunctivitis that flare up into the eyeballs and from people that suffered from the virus that's maybe not evident directly as well. And if you had a certain skin condition, post-virus and post-vaccine, it could worsen. But again, it's not for everyone. So we have to look at every patient as if this is the first patient we are treating, the only one.
Of course, and it's so individual. I mean, we all know treating skin that each patient is very individualized, and you need to adapt to that person's response, skin response, as you're doing the treatment. You know, clinical endpoints may vary from one person to another when you're actually treating, and inflammatory reactions can, and all the rest of it. But it's important to carry that philosophy over with. It's not a cookie cutter approach. When someone's had a vaccine, just because they've had a vaccine doesn't mean they're going to have a reaction to a skin treatment. So, you know, everybody's kind of a little bit worried now. Should I treat skin? Should I not treat skin? Should I wait 14 days? Should I wait a month? You know, we have some people giving advice that they need to wait a full month before having skin treatments, you know, after the vaccine. And, you know, I think that global approach, that, as you said, a very generalized approach is probably not what we as therapists are taught how to operate, you know, taught how to assess. It's more of a, you know, case by case basis. And so I think that the therapists out there who are listening, don't be scared to treat to perform skin treatments. There's a lot of skin treatments you can perform very safely. And if you do all of your checks and balances, all of your assessment, you're watching your clinical endpoints, you're doing the right thing whilst you're treating, you can actually treat very safely. And we're going to talk about a little bit about parameters of you know, what should we do? How long should we wait? You know, Eunice, I'll ask you, if somebody has a vaccine, how long are you recommending in South Africa to wait before you actually have a skin treatment?
Now, there's again, waiting, there's a lot of controversy about that.
There is.
I like to, if a client did have the virus and if she had the vaccine as well, I like to wait 3 months to do invasive, more active kind of treatments.
So virus and vaccine. This is not just vaccine, right? This is both. Because we are in Australia and we haven't had you know, obviously I'm not sure what the numbers are like in South Africa, because the numbers here aren't. Pardon?
Hundreds of thousands.
Well, we've got not even thousands. So it's the chances of us treating people with COVID a little bit less. So COVID plus vaccine means roughly a few months.
I wait 3 months then, because obviously I have to determine if she had the virus, how ill was she, and then the vaccine, how did she react? Did she have the typical reactions? And the treatments I usually wait for post-vaccine purely is waxing, because the skin can become sensitized. I know waxing is popular. It's summer in Australia and in South Africa. We want to be waxed, but wait a bit. Do a patch test first on a sensitive area. Your chemical peels, don't go for harsh peels within 3 months after a vaccine. Just wait a little bit. You could have a mild treatment.
This is vaccine and if you've had COVID.
Only vaccine. I would wait about 6 weeks. I'll have my vaccine, and 6 weeks later, if I don't present with any of the reactions, because within 6 weeks, you will know whether you are having a different reaction on the skin. Your microdermabrasion treatments, your microneedling, your laser treatments, your active treatments where you put acids in the skin, Botox fillers. We also say after the vaccine, wait about 6 weeks. If there was some skin reaction after the vaccine, wait 3 months. But you could still do mild treatment.
Wow. In South Africa, it's...
Really,
no one's having skin treatments in South Africa, it looks like.
No, we are back on track. What we do, and that is what I want to really highlight, is what do we do? First thing is patience. If there was a vaccine, if they had a reaction, let's talk vaccine only, there's a reaction on the skin. There is maybe hives, maybe 4 weeks after the vaccine, suddenly the client comes out in a rash. you will wait your time. You'll just do maybe a lovely therapeutic type of treatment with a bit of love and pamper for the client. If after the vaccine, after 2 weeks, there's no reaction whatsoever, I would go back to doing my normal treatments, but I'll still wait to do excessive peels. I'll still wait. The doctor that I go for the odd little Botox now and again, he wait 3 months before I was allowed after the vaccine to have my Botox.
So varied.
Yes, so they all
so varied, because the TGA has put out obviously a statement saying that, you know, even though there have been some reports that there's been localized swelling post-vaccine in the injection site, obviously where the product is in the face, and this is filler, not Botox, that it is few and far between, is rare, and that it shouldn't, I suppose it shouldn't hamper you in going and getting a vaccine if you've had, certainly if you've had dermal fillers, don't put off getting a vaccine if you've had them. But what post-vaccine, they're saying 2 weeks, and 2 weeks is a safe point for them. And obviously we know that your immune system is still going quite strong after 2 weeks. There's still changes happening in your body. And when you do put foreign substances in your body, your immune system may miscalculate and think that, look, this is the invader I need to trigger, and that's why you get swelling at the site where the product is, because it's your body mistaking that for being the foreign invader that they're seeking to destroy. So we've had that advice, the 2 weeks, and that's what we're saying. You know, you minimum need to wait 2 weeks. However, some people are preferring to wait 4 weeks and be conservative. Some doctors are preferring to wait a little bit longer and be conservative. And I think we should always bring it back to that first initial point that you said, is that everybody's individual. If you ask it's all about assessment as well. When you've got a client in the room with you, you would ask the questions, how did you feel after the vaccine? Did you have any reactions to it? Were they skin reactions? Are you noticing any increased sensitivity? Asking all those questions beforehand, and then that gives you a real picture of thinking, okay, I think I need to wait a little bit longer with this client, or I can do it now,
I think the main word for us as therapists to remember is consultation. Consultation. Because, and that's always, it's not even just with vaccines and COVID, but to really sit with the patient, the patient, to really analyze what has happened to this client. And, we also have to consider this whole emotional and psychological effect of the lockdown on clients. Sometimes that could trigger skin reactions that's not even related to the vaccine. So a thorough analysis, which will then indicate to you, this is fine, I could stick to my local guideline of 2 weeks, or I'm a little concerned, I'm going to wait a month. And as I said, some of the surgeons in South Africa wait 3 months before they do invasive techniques like threads, but that's again per doctor, per practice.
That's right.
All different. And then when you go back, make sure that your brand is focusing on your barrier, is focusing that the damage that was done, because remember, if there was an inflammatory cascade after your vaccine or after the disease or both, your barrier is lacking in hydration and in moisture. It becomes impaired because my body had to fight so hard to focus, to build up an immunity, that those areas, hair, scalp, nails, barrier, furthest away, actually gets the least oxygen and the least nutrients at that point. So your brand that you use must have an ability or functionality to repair the barrier, to replace those bilipids, and to use peels that are superficial, that's not going to cause frosting in any case, that is going to have delivery systems, that is going to take those actives into the skin in a very responsible way, so that we never compromise our client's barrier even further. Because no matter if you had severe reaction after the vaccine, your barrier will still have had an effect and have had a result on the barrier.
Of course.
All the time.
Jen Thompson. Hi, Jen, by the way. She's popped a question in, or really a comment in, which is actually really timely, because she said, we are finding even the topic of conversation of vaccination in the salon has been difficult here in Queensland. And I think that sentiment is echoed right throughout the nation, starting the conversations about you know, even really for us, because we're having to check vaccination status in some states, has been challenging. And then asking, I know that, you know, I have clinics as well, and so I've trained my staff to ask before they book in for dermal fillers, clients book in for dermal fillers or for skin treatments, even for Botox, we ask them, when was the date of your last vaccination? And was that your second or first vaccination? And it's actually, it's an open, I think that phrasing it that way is an open doorway to then talking about the issue, because it relates to the skin treatment itself. And, you know, opening up the conversation is very difficult, we know. And, you know, in the very beginning, it was very difficult for us to ask our patients to wear masks throughout. And, you know, there's been so many difficult challenges in this whole you know, situation we're dealing with, and this is just the latest one. But we're very resilient. We know what we're doing and we know why we're doing it. And I think we need to just muster up that confidence and really have that empathy and care for clients when we're asking that question. It's not because we want to judge their vaccination status. It really is because we want to understand, how do we best treat you? How do we best assess your skin? And that conversation starts with, is there anything that you have done that could have influenced the state of your skin at the moment? And one of those important things is vaccination. So thank you for mentioning that, Jen. And also Tamara has commented, Tamara Reid, hello Eunice and Steph, super helpful conversation you're hosting tonight. Thank you so much. It's very timely. A lot of people are asking this question. So I'm hoping if you jump on and you're watching, please stay on, because we're going to be talking even more in depth about this topic, you know, a little bit further on. But let's take it back a step, I suppose, and go back to, you know, this tailoring approach that you're saying. Let's treat each individual and each patient really, really like you know, the individual that they are. What are the questions, specific questions that we should be asking? Like, let's give them a list of questions so that they can go, okay, I'm going to go back and ask my clients this.
Absolutely. You know, I think it's the easiest way to look at this is to look at the symptoms you associate with having had the virus or having had the vaccine. So if I know my client has had the vaccine, I will ask the typical question, what did you experience? Was there swelling in the area? Was there irritation in the area? How painful was it? Did something change within a day or two on your skin? How ill were you after the vaccine? And then to look at the severity of the symptoms. In one of the papers I read, it indicated that the severity of the symptoms post-COVID and post-vaccine also indicated how long it will take to be able to have treatments again.
Absolutely. Very important point. So if you miss that, it's the severity of the vaccine is going, and the reaction of it is going to dictate probably a reaction that you're going to have, a similar reaction to your skin treatments.
Yes.
They correlate.
And something simple like, it happened to me as well. I suddenly developed a bit of a redness on my fingers and it's eczema-like look, and I never associated it with any of these things. And then when I started to do a lot more research, you get something called post-COVID or post-vaccine toe, where there's inflammation because of the inflammatory cascade swelling on the toes, even the fingers, or on an extremity of the body. Yeah. Yes. So asking silly questions like that, or that they might find, why do you want to know this? But it actually could relate to having had a reaction that they weren't even aware of or associated with COVID. We have seen people that only develop the symptoms a week after, whether it's the illness or the vaccine. So I would ask them again, like you said, when was the last time you had your vaccine? And I don't know, Australia, how strict you are with having had the vaccine to be allowed to come for treatments, but I know it's not compulsory in all countries at the moment to have had to come as a client, but I know therapists, it's very important, and to then know what to look for in what they possibly have experienced or maybe have not associated with the disease at all. One of the other things that we have seen in some of the research was balding patches.
Mm. Yes, I've read that as well. It's quite interesting, isn't it?
Very, but very, very upsetting for the client, not understanding how it works, but basically why my body is fighting to protect against whatever invasion I've had, whether it's a vaccine or a disease, to fight it off. And that's the last area that it's going to support. And then I've had patients saying to me, I've gone for my highlights a couple of weeks after the vaccine or a week after, and it didn't take, or it came out orange, or
so it came out orange, or my hair snapped. Yes. You know, things like that. Okay. We've heard quite a bit of that as well. I've been reading a little bit about it as well. Absolutely. But you know, we understand, like, if you think back to what we've learned as therapists, we understand why that is, right? If you're under an extreme amount of stress, say you've gone through a period where you've had a tragedy, or you've been under a lot of stress because of work, or you've been really severely run down, you can get episodes of, you know, skin disorders. You can get episodes of, you know, hair thinning, and those things actually happen to your body when it's naturally under stress. And we've got to remember that the vaccine is a form of stress, even though it's a form of stress that actually causes your immune system to recognize then COVID and fight COVID. It is a form of stress on the body for hopefully a positive result. But you know, a lot of people think, oh, well, I've had my vaccine, I've waited 2 weeks, I'm fine. And that's why we say wait the 2 weeks, because within those 2 weeks you can start to see those changes happening within those 2 weeks. Even if you've got no symptoms, if you know, I was speaking to someone today, this was such a strange conversation, but I've had it twice now. One of my staff members, my ex-staff members, who's now coming back to work for me, said to me, oh, I've had the second vaccine and I feel amazing. I've had this persistent sinus infection for the last 12 years and it is now gone. After the COVID vaccine, I feel the best I've ever felt in my life. I'm hearing this a bit.
I have another one then.
I've had this. And then you think to yourself, well, why is that, right? You've had a persistent sinus infection for, 12 years that never went away. Well, your immune system just kicked into high gear and is just going flat stick, trying to get rid of, trying to dust. And maybe that's a consequence of it. It happened to be a good consequence. But it's so powerful that it did that. You've got to understand that that's what's happening underneath your skin, underneath your inside your body. That type of reaction is still happening, up to 4 weeks, 5 weeks, 6 weeks later.
And your skin is an organ. We know that. We are qualified skin therapists, but it's a wonderful organ. So why would we have more respect for the liver or the kidneys or the lungs or the heart being affected by certain vaccinations or viruses, but forget about the skin? It's a huge, beautiful organ there to protect us. And I think that very importantly, if we go back, treat every client individually. Treat them as if it's the first time you see them post-vaccine, doing your thorough consultation again. Check for any changes, because we often see hyperpigmentation, because hyperpigmentation obviously often develops due to a higher level of inflammation in the skin. So that could even present 6 to 8 weeks after vaccine or COVID. And you've forgotten about the vaccine. You're feeling great, your sinus is away, and suddenly there's more hyperpigmentation, which could mean that just because of that inflammatory cascade and your cell turnover, it's when it presents. And it might not be the direct sun exposure or environmental exposure. It could be related back to that. So look at signs, look in the next treatment she comes. Now, I've explained, I said to you, I've had the virus and I was really, really ill for 4 weeks, very, very, very ill.
Wow.
And what I did after the 4 weeks, I really didn't want to and couldn't, and was so ill, I didn't want to have anything done. And about 6 weeks after I was recuperated, I thought, okay, I need to get better, because psychologically it really takes a strain on you, because it's a very near-death experience sometimes. and I'm going to have the hair highlighted, and I'm going to go and have all my treatments again. And that's when the doctor said to me, you'll wait another few weeks for your Botox, etc. But after my vaccine, which then I had to wait 6 weeks before I could have my first one and my second one, I could go back for my peels that I have 2 weeks after my second vaccine. But as I said, because maybe I was severely ill, they waited 4 weeks before Botox. But peels, I had a bit more hyperpigmentation afterwards, specific, I think, relating to the vaccine and the next level of inflammation. So do look at that. Look at aging. Lines and wrinkles form when there was a lot of stress in the body. It becomes more visible because of the barrier. You see a lot of dehydration more. You see the dryness more visibly and a bit of flaking maybe. And it's not a bad thing. It's normal. It's natural. We are going to treat the skins again with our product, with our treatments to repair the skin, to heal the skin, because that's the ability we have with the equipment we use and with the products available in our markets that we use as responsible therapists. We can help a skin to better health. And I think we must not be scared. Just do a proper analysis, really listen to the client and what she's not saying to you, and look at the skin thoroughly. And maybe if you see a bit of pigmentation, you know what to do. You've got your product there at hand. You are being responsible. You're adhering to all your government and all your industry guidelines. And then, of course, being seen as an individual for your treatments, and asking questions that they maybe don't relate to vaccine and COVID, even sleeping patterns. And a big thing that we have seen is in our clients' depression. And post-vaccine COVID, because of the hype, because of the nervousness, because of the awful lockdowns we have been in. And I know Australia's had real severe lockdowns. The people were struggling. I was following you guys on Facebook and on Instagram and the clients I know there, and I've seen the worry and the stress, and that will also have an effect together with the vaccine that the clients have had. So we need to look at our clients again as absolute unique individuals when we get them back on board, coming back to us for treatments.
Thank you for that, and thank you for mentioning the long lockdown that we've been in and the emotional, physical stress that we've been under, because a lot of the time people are worried about, you know, the post-vaccine reaction, but what about the fact that we've been under a stress for a long time, that even if a person hasn't had a vaccine, their skin's going to react differently. So your client that you saw pre-lockdown, when times before COVID times, you know, their skin might behave differently purely just because they've been, you know, lacking in vitamin D, not going out, and, you know, into fresh air, being severely dehydrated, you know, being locked up and stressed and depressed for a long period of time. That has an effect, all has an effect on our skin. And so I suppose I'd love to ask you a question about how do we, when our clients come back, how do we structure the treatments? You know, what are the first treatments that we can do for these clients emerging out of lockdown? You know, what are the second sort of tier treatments that we then move them onto before we then move them onto, you know, the good stuff, the deep stuff, you know, the deeper peels and the deeper and the microneedling and a little bit more intense, I suppose, you know, even Q-switch treatments and heat-based modalities. How do we start from no treatments post-vaccine to let's get them to their full treatment?
Well, what I recommend we look at, and what I recommend we do is to start again with understanding and looking at the skin. So first of all, I would want to see that my client has a healthy barrier. So I think your first aim should be to get the barrier healthy. Now, we know that your barrier is the most important part of your skin, if I can call it that. And it consists of obviously your stratum corneum, but also your stratum microbium, which is the very top layer over your stratum corneum. It's not part of the appendages. It's that layer with the trillions of wonderful microbes to keep the skin healthy, and they are compromised together with your stratum corneum when your barrier is unhealthy. So getting your microbiome layer healthy together with your stratum corneum by basically replacing the biolipids. I think we all know, if you know the brick and mortar story, where your biolipids look like bricks and cement all around. And if I look at an old building and the bricks are starting to look older and the cement is starting to fall out, that's what a compromised skin would look like, compromised barrier. So we want to have beautiful new bricks and beautiful firm cement between the bricks in our skin cells. So that's where I recommend we start. Whether she did not even have the vaccine and came back with a compromised barrier due to the environment or due to what she's experienced emotionally, make sure that the barrier is healthy. If your barrier is healthy, you can basically start to do anything. So if your barrier is healthy, she comes back 2 weeks post-vaccine, 3 weeks post-vaccine, I look at the skin, do a thorough individualized consultation. I start with a less is more approach, slow and gradual. What's the barrier like? Is my barrier healthy? Do I see a lot of transepidermal water loss? Do I see a lot of dehydrated signs? Do I see a lot more lines and wrinkles around the eye area maybe? And first, repair that barrier. So the barrier treatments will start, the barrier home care, depending on what brands you offer. And then what we will do is possibly by the next treatment, it could take about 28 to 40 days, depending on the age of the client and the cell renewal process. We could, if the barrier is repaired and healthy and there's less water loss in the skin, you can start with your mild peels. You can start with your 35% glycolic acid peels. You can start with certain of your combination acid peels, and then only look at the reaction, how the barrier is reacting. Is there a bit of sensitivity or delayed sensitivity? And then follow the guidelines of the brands that you stock. From there on, follow the guidelines of the injectables, follow all the guidelines that you have in place, the laser therapy, but start maybe just with a first barrier repair approach to the skin. If you have a healthy barrier, the skin is ready for basically everything else.
Amazing. Let's give them a couple of ingredients, I suppose, that we can start off on the very first phase. You know, we're looking at, you know, if they're very dry and flaky, can we introduce an enzyme, a gentle enzyme?
Could, you know, you get lovely gentle enzymes. I personally am very fond of pineapple and papaya enzymes. Of course, it's in the brand that I represent as well. An enzymatic exfoliator or peel is gentle. It does not disturb the barrier. It's got a very superficial reaction, but very effective. I have seen amazing results with just enzymes on the skin, whether it is an enzyme as an exfoliator or an enzyme as a mild peel. So definitely, obviously know the brand, know what types of enzymes they use. If they use pumpkin enzyme, depending on the formulation, pumpkin can be mild, but also quite severe. So you have to
be quite, yes, depending on the formulation. And also you were talking about enzymes, but fermented enzymes as well. Yeah. Very important, because your microbiota is affected. So anything that you're putting on there that's got a ferment in there or has been through the fermentation process, that's gold for your skin.
Absolutely. So look at the ingredients of your enzymes. Look at your absolute fermentation is the next way to go. Look at types of prebiotics or probiotics that is available in the brands that you stock. Look for brands that maybe can support the skin on a pre or pro or a pre-pro and postbiotic kind of way. And then we will introduce mild acids, your typical lactic, glycolic and citric, looking at different molecular sizes, looking at the concentration of the acid, how high the level of the concentration is. But you can't just look at that. You've got to understand, again, how the formulation works. Is it working on a pH system? And what is the pH of your formulation? Not less than 3 is obviously a safe way to go. Or is it working with a pKa scale, where you look at the individual acid value? So knowing the brand that you work with is very important, but I would start with gentle enzymes, working into more advanced enzymes. I will start with gentle acids, your typical, we all know the glycolics, the lactics, the citrics, and then even pyruvic, which is a wonderful acid, but that is actually quite gentle. So you can definitely start to introduce your acids. And then, of course, depending again, what type of brand you stock, you can go more into your, depending on who you obviously visit, your more advanced clinics, you can go for your medium depth peels. But I would not have a medium depth peel within the first, I would say, 6 weeks. I would start with barrier repair and milder ingredients. The brand that I work with focuses a lot on barrier repair, but also a lot on feeding the microbiome. Because if you have a healthy microbiome and a healthy corneum, stratum corneum, you can lead to a healthy epidermis and dermis, of course. And we can never go wrong with hyaluronic acid. I mean, that is a wonderful way to also get the client back, coming back to you, some treatments with hyaluronic acid, peels with hyaluronic acid, some product, home care product that they could use at home, because as important as it is for us as therapists to take big responsibility in how we treat the skin, sending them to the right places for their Botox fillers, threads, and their laser treatments, we need to teach our clients to take care of their skins at home. They need to work together with us to get the best result, whether there was COVID or not in any case, but always after the vaccine, after having had it, after many diseases that we'll possibly still come in contact with over the centuries, but to really be able to get the client to invest in home care. Because that way, with the right home care, by using certain enzymes in their home care, by using responsible formulations in their day and night creams, their serums at home, they are also preparing their skin together with us for getting back to normal, if there is a normal nowadays.
A new normal, I suppose.
A new normal.
I think that you've given us some great advice. I think that, you know, get that sequential way of going, okay, how do we repair, nourish, renew, nourish, and then when we get the skin to a healthy, strong phase, that's when we can start to rejuvenate, you know, and start working on the deeper layers and working on collagen induction and things like that.
Do not forget, when you repair the barrier, to also have a focus of protection over the skin, because we can keep repairing barrier, we can repair the skin.
Protection, yeah.
Rejuvenate. But if we're not going to protect, we might not even do it. So that really goes hand in hand, especially now, especially post-vaccine, etc.
It's wonderful that you've said that. You're right. Protection is extremely important, and that comes with the nourish part of it. You know, putting that nourishment back in, and you build that natural protection. And that's going through the gamut of, you know, you need to sometimes remove that, you know, outer layer of skin, your stratum corneum, that's, you know, that's impaired and weighing the rest of your skin down. Sometimes you do. You're saying you can see people with very dry, flaking skin, and you want to gently be able to remove that, so you can then deal with and encourage some kind of nourishment in the alive good cells that are left. But we then want to protect that on top, absolutely. And so going from that type of system, whereabouts do you think heat-based modalities come into that? Because I own laser clinics and skin clinics, dermal clinics. We're doing heat-based modalities right now, and I can tell you what our procedure and our protocols are. But what do you think is the right way of approaching it?
If your barrier is healthy, if your barrier is repaired, if you've done your analysis thoroughly, and you can see it working on a healthy skin, go for it. With responsibility. With
respect and responsibility.
Yes. And also, as a therapist, you know, be responsible towards yourself too. Do remember, you also had the vaccine. Remember, you're also still wearing goggles. You're also wearing gloves. Be responsible to yourself too. We had something called Self-Love Sundays, just to love ourselves as therapists again, just giving ourselves something back. And don't forget that you are also a client. You are also part of the people that are terrified, but don't be. It's a wonderful thing we are doing, and we are having the tools to get our skins through this as well.
Thank you so much. It really is a timely reminder to we are clients too. We neglect ourselves sometimes in giving all this love and treatment to our clients, but we've got to do that for ourselves as well. So important. What I'm saying and what I'm recommending is, you know, if you have light-based, non-heat light-based modalities such as LED, low-level laser, I'm saying everybody who's coming in for a skin treatment gets a dose of that before we even start. I'm talking pre-treatment. So, you know, you get a good 5-10 minutes underneath the LED, and then we start to work with the skin, you know, and then a little bit even post. So depending on what treatment you do, but, you know, low-level laser, LED, those types of treatments have an anti-inflammatory effect, but they also stimulate collagen production. So they stimulate the cell to work in the correct way. They stimulate the mitochondria, which through the vaccine and through even having COVID, the mitochondria, as you said, they're severely depleted and affected. So we want to start recharging the skin. Let's get it back to working in the right way. And most skin clinics out there do have a non-heat light-based modality there. Utilize it. Don't leave it sitting in the corner. Introduce it into the packages and the treatments that you put together. Utilize your enzymes, you know, do all that nourishing stuff beforehand. Your clients will love it because they're actually needing that, you know, gentleness. They're needing that tender love and care. They don't necessarily want the heavy stuff right in the beginning. And I would also say, if you're going to do any of the more in-depth types of peels, or if you're going to do a heat-based modality or use a heat-based modality, ask the right questions beforehand. See whether or not this person is the suitable candidate. If they then are, test patch, watch, check, test patch again, watch, check for your clinical endpoint. You don't need to push it. People's skin are probably already going to be overreactive. You probably need to step it down a bit. You know, if you're used to dialing it up, dialing up the fluence, dialing up the power level, maybe take it a step back a little bit. Do an area, wait, ask them how they're going, take a little break, start again. And you can apply this as well when you're doing skin treatments. You know, check in with that patient throughout. If you're watching the skin, you're checking for those signs and it's all looking good. Don't be so scared. You can treat, but always treat with respect. It's no good everybody going in being really fearful of what they do and not having trust in their own profession and their own selves. So I think that's important to say as well.
Absolutely. Remember that we are well qualified. We are well experienced. If you are still new, you've got peers that are there to advise you. And I am sure that you stock really great brands and use the support from the brands that you stock from, the distributor that you order from, to also give you some guidelines. And just one thing I must mention this, we sometimes forget the medication that people are using when they had the virus and sometimes post. And do remember that most medications also contribute to inflammation, also contribute to rashes, to pigmentation, to lines and wrinkles, name it. So that's why, to me, it's consultation, barrier repair, slow, gradual approach, and we have it in our hands to fix that.
Love it. I love it. Thank you so much, Eunice. You are a wealth of knowledge and information, and you're also so lovely to speak with. I hope you come back and visit us again.
Thank you so much. Well, I hope I can come to Australia soon.
Oh, I hope so. That would be wonderful.
I miss traveling. Thank you for the opportunity and for what you do in your industry. It's really remarkable, and hope to see you soon again. Thank you, everybody.
You're very welcome. If anybody has any questions about skin treatments or about what you can and can't do, or just needing some advice, you can always reach out to ABIC. We're here to help you. And also Vital Plus, who is our lovely sponsor tonight, who Eunice is a part of that organization as well. Reach out to them. They have some amazing products and brands within their group that can actually help you to overcome some of the things that we've talked about tonight. So thank you, everyone. It was lovely being in your company tonight. Have a great great night. Bye, everyone.